Welcome back, everybody, to the OPT Network. This morning, we're talking about healthcare and what you really need to know in making the best decision for yourself and for family members. Our guest this morning is Mick Essex. He and Vantage Health have been longtime partners of the OPT Network. Mick is the Regional Marketing Coordinator for South Louisiana, and we welcome him back to the OPT Network. Mick, good morning and welcome back.
Thank you so much. Glad to be here.
Absolutely. So Vantage Health has been serving for 2 decades, but not just serving with such excellence and such excellence in customer care that I've never seen anything like it. Like when you first started on this journey, you were going to people's houses, sitting at the table at their house, helping them understand, especially when we're talking about seniors. Talk about where that mentality came from.
Yeah, it's a very interesting company to work for because although it is traditional major medical health insurance, it doesn't operate in that capacity really at all. And a lot of that has to do with our founder, Dr. Gary Jones. He was a family doctor. And back in the mid-90s, he was having so much trouble trying to get claims paid for his patients that he just started an insurance company because that's what people do, right?
Of course.
But he built the entire company around the fact that what's most important when it comes to your health insurance is that you're taken care of and that you get healthier. That's the whole reason that we're a company. So from the very beginning of the company, that was always what we strive to do, is to make sure that those that had our health insurance, that they could get answers, they could get their claims paid, and ultimately they could feel better.
Absolutely. Now, this is not our Dr. Gary Jones, who's the cardiovascular surgeon here in Alexandria, but Dr. Jones understood healthcare and people needing to have the services provided for them that they needed. And so then he starts this company and it grows. But taking care of the customer was really paramount.
It really was. In fact, for the first 11 years of the company's existence, we lost money every year. It was never about profit. It was all about, and of course we've since grown, from there. But even though after year 7 and 8 and 9 of losing money year after year after year, he knew that the way the company was set on their principles and our process is that it was just a matter of time. So, for example, I was hired in 2013, and at that time I was employee number 352 or something like that. So just in 7 years, we've gone from that to having 26 different locations, and we have almost 2,000 employees now in just 7 years.
Wow.
That's remarkable to me.
So it just, once that the momentum started, it just started growing like gangbusters. And so then you started really focusing on Medicare. But first of all, tell people about Vantage Health and the company, because at one point people really didn't know the name Vantage. Now it's become more of a household name.
Right, exactly. And that's always the struggle that you have, especially in the insurance industry, because most of your insurance companies have been around for 100 years or more. So you're used to hearing the same names over and over again. So trying to stake our flag in that market was really difficult. We struggled for a while because people thought we were like a supplemental type insurance company, but in fact we're a major medical health insurance issuer, which basically means that we write the insurance policies. It's underwritten from the beginning. So we're not a reseller or an agent, per se. We're the actual issuer of the health insurance. So because of that, we're able to, we're an option on the marketplace for the open exchange through Obamacare. We also do group coverage for small and large companies, and then, of course, Medicare as well. So we cover all service lines as it relates to major medical health insurance.
And one of the things that was most impressive, if you go onto the marketplace and you look at, the gold standard of what you can get in insurance, Vantage is substantially less than a lot of the other companies, but provides the same grade 8 service.
Exactly. Yeah, and that was part of what gave us our big boost in not only visibility but membership as well, was whenever the exchange opened up in 2014, we were expecting to bring on about 1,500 new people. These are people who had never had insurance before. They really didn't know, what it was they were buying and what it would do for them. And our call center, we saw just tremendous growth from that. And instead of picking up around 1,500 new members, we got almost 12,000. So we were not ready for that at all.
Instead of 1,500 or 1,200, we've picked up 15,000?
Yeah, in fact, we had them over 4,000 just in the city of New Orleans alone, and we did not even have anyone in New Orleans. It was just that whenever they started shopping, just like you would on, Amazon or anything else, our names kept coming up at the top. We had the best price, and we had the best benefits, and then they would call and ask us about it, and someone actually answered the phone, and they sounded just like they did, because our call center's in Louisiana.
Sure.
And so it was an easy transition for them to make. So that was unexpected for sure. We had to go on a mass hiring spree. In fact, in 2014, we doubled in size in 1 year just to take on that large membership. So that really changed a lot of things for us. It gave us more of a household name, as you said, just because we were showing up so very frequently. And then even after they bought it, they actually got good service.
I was getting ready to say, and so it wasn't just that you had this exponential growth, but the service behind it, because I'm sure people were kind of concerned, will I get the same kind of coverage, the same type of customer support that we've known like for hundreds of years? Will I get this with Vantage?
Right.
And the answer was a resounding yes.
That was the part that really took fire all on its own. This was not something we had to advertise, because whenever something very good happens to you, you want to let people know about it.
Sure.
So everyone's accustomed, if you call a huge company of any kind, insurance or otherwise, you expect to have to press 1 and then 7 and then 9 and then 4 and then sit on hold for half an hour.
Right.
You call the number, you press 1, you sit on hold, and usually within a couple of minutes, somebody's on the phone. Not only that, you can actually ask for their direct extension, and they'll give it to you. So you can call back and talk with that same person who knows and understands, whatever the issue might be. So that was what I heard more than anything as far as how they felt about things, is they liked the fact that they could get someone on the phone, they understood what they were saying, and then they could even call them back directly if there was an issue that they wanted to follow up on. And most companies just don't do that.
With that kind of growth, Mick, were you guys concerned? Because in the beginning, it was, I know you were traveling around the state. I mean, literally sitting with people to help them to understand. Were you guys concerned that you wouldn't be able to provide that same personable customer service and care that you had been giving all those years?
Absolutely. I mean, that was definitely a concern that we had. And as the numbers started to grow very rapidly, it was understood that the 8-hour workday and the 40-hour work week doesn't exist right now. So I was traveling over 1,000 miles a week, and
Wow.
we were sitting at the kitchen table and sitting in the living room, and sometimes on the back porch even, and just whatever was necessary. We were going to make sure we got that done. So we expanded our call center hours. We did a mass hiring. Did more of a fast-paced training, I suppose. But everything that was put in place as it should be. The oversight was there to make sure that everyone on the lower level understood their responsibility, what was expected of them. Like you said, we wanted to make sure things continued like they were. So we put all those things in place to make sure that happened.
Absolutely. We're going to take a break here, but when we come back, we're going to talk about Blue Cross Blue Shield and their relationship to Vantage, and help people really understand what that relationship looks like. Plus, we're also going to talk about Medicare and how to better understand it. Stay on point. We're back with more right after this. Welcome back, everybody, to the OPT Network. Our guest this morning is Mick Essex. He's the Regional Marketing Coordinator for South Louisiana for Vantage Health Insurance. And we're talking about how Vantage is growing, but most importantly, how they are continuing to provide very personal, very excellent customer care. And so before we went to break, Mick, we were just talking about the growth, but there was a situation where Blue Cross Blue Shield and Vantage came together, and a lot of people were really sort of confused about that relationship. Tell us about it.
Yeah, so whenever those talks first began, it was originally approached as Blue Cross buying the company. As we began the process of vetting and all of those things, it made sense that instead of that they buy into the company as opposed to buying it out. Mainly because they saw how we took care of people, and they saw our strong customer service rating. It was one of the things that they struggled with as far as their customer experience was exactly that, because they are a monster company naturally. So as talks began to improve, that was where things began. We want to buy into your customer service experience. Once that began, they started to see how our processes actually were done for Medicare. So then the talks began on, can you help us with our Medicare experience as well? And it just kind of mushroomed from there. So a few years ago, they did buy into the company. They bought a majority stake. But it was an investment in the company as opposed to being a buyout. So as time moves on from here and on, we're always going to be two separate companies. We're always going to be on different platforms. There has been some integration. They had a lot of IT experience that we didn't, that we were able to borrow from. Their compliance department was obviously much larger and stronger, so there was some blending there. And then ultimately, the customer service piece, as far as call centers goes, we're going to assume a greater role within their customer service because they want their members to have the same experience that ours do.
So there was just a blending of what you guys did well and what they did well, and you just sort of mesh those two together, but Vantage still stands on its own as Vantage Health.
Correct. Yeah, and that'll never change.
Sure. And so when it comes to Medicare, so many people have questions about how to choose which company they will go with when they're choosing their Medicare. And especially when we're talking about seniors, understanding their benefits and what they get, and what they pay for and what they don't pay for. Just sort of break that down in a way that people can really understand.
Medicare is extremely complicated.
Oh, it is. It would take us really shows to really.
Oh gosh, there's no question about it. I mean, just to have an insurance license is over 200 hours of lessons and testing, and then after that, every year we're required to do 40 additional continuing education hours just on Medicare. And of course, then there's a whole litany of tests that we have to take, both state and at the federal level.
Right.
So as I learned, because I did not come from insurance, this was new for me. As I continued to learn, I could not help but think, how is the little grandmother that lives in the country? How is she going to be able to understand all this? So as I started to grow in my role, I looked at it from that perspective. So as I learned, I wanted to make it as easily explainable as I possibly could, because these poor folks, all they have is usually their television, and then the mailbox is full every day with all these plans. We're the best. We're the best. We're the best. So
this is free.
And exactly.
This is free. You know, and I see it with my mother, the confusion. And the thing that I love about Vantage is your commitment, your personal commitment to going and talking to, octogenarians, those people that are 80 and in their 70s and 60s that really can't understand what to choose, and breaking that down in a way that is in bite-sized pieces so that people are very clear.
Right. It's exactly right. And within our department, our goal obviously is to bring on new membership. But whenever we send out a mailer, they call the number on it, they get an explanation. With your other larger companies, typically they want to close that sale on the phone.
Right.
We've never tried. Our goal was to get into their home so we could sit and look at them across the table and explain things as we went. Do you understand this? Because that was our value proposition, because we didn't have the names of the big companies. So what made us different is the fact that we do thousands of home visits every year, travel all over the state.
That's unbelievable in 2020.
Yeah.
That is unbelievable. Yeah,
I mean, of course, as we move into a more digital world, we've had to make some adjustments, but our goal is still to get a home visit appointment so we can sit down with them and explain how these things work and give them my cell number so if they have questions, they can call me back directly. We want that very personal one-on-one connection because we're never going to have the money to spend for advertising. We're just not, that's never going to be who we are or what we want to be. My boss, he explained it very well on a different show we were on a couple of years ago, and he said, we don't want to be like Blue Cross or Humana or United because those already exist. We want to be, we don't want to be like them. We want to be the only us. And that's how we've always approached it.
Right, and you're making your own footprint in the insurance agency, in the insurance business. And so when you talk about Medicare and all of the complexities, what's the most important thing that you want seniors or people who are helping their parents choose Medicare? What do you want them to understand about your difference?
We want them to understand what all is available to them. Most people buy health insurance because they don't expect to use it. They just have it in case something bad happens, quote. Whenever you're 65, 70, 75, you're going to be sick all the time. You're going to have medications that you take all the time. Not everyone, naturally, but the vast majority. So they know that they're going to need to use their health insurance all the time. So we try to make them understand of all the things that are available to them at no cost. You can get your wellness exam at no cost. You can get eyeglasses and an eye exam almost at no cost. You can get your generic medications in the mail for no cost. We'll take you to and from your doctor visit if you need to. We'll take you to see a specialist up to 100 miles away. We'll drive you there and drive you back home. We have over-the-counter medications and toothpaste and toilet paper and all those things that you can get every quarter at no cost. So there are several things that are built into a health plan that most people don't know are there. So of course we talk about the benefits and how much a doctor's visit costs and the surgery. But let me show you all these other things that come along with it. You can get your teeth cleaned and x-rays twice a year for free. All those things are there, and we find that most people don't know that.
Right.
You know?
And then when you're talking to seniors and you're using the word free, sometimes there is discrepancies about free and free.
Right.
You know what I'm saying? If you know what I mean, free,
absolutely.
is it really free, or is there something underlying attached to it?
There's that happens a lot, and there's actually specific language within the rules of Medicare. We're actually not allowed to use the word free just explicitly, but that's what usually happens. If I said no cost, does that mean free? I mean, that's what the question is going to be.
Right.
No cost and free may be two different things. But yeah, that's the whole purpose of Medicare. Because it's a federal product and because Medicare is funded through taxpayer dollars, they want the cost to be as low as possible, right? So if as a nation we take in $1 trillion a year in taxpayer dollars, we want to have the total number of claims paid under $1 trillion. Does that make sense?
Absolutely.
You've got to have more money coming in than going out.
Right.
Before Medicare Advantage companies like us came along, those numbers were way, way off, and Medicare was becoming very close to being insolvent, which means it was going to have to shut down. So Medicare Advantage was created, and companies like ours were created to be a gap between the Medicare institution and the person and the doctor in between. We're a go-between. Is this necessary? If it is, it goes to Medicare and the claim is paid. If it's not, it goes back to the doctor. So that's kind of how we're positioned in the linear process, is that we do all that we can to keep costs as low as possible. That's why there's so many different things that are available at no cost, because if you go get your wellness exam every year, if you take your blood pressure medication, you're not going to have a $500,000 heart attack surgery.
Right.
So that's the ultimate goal, is to keep people out of the hospital as much as humanly possible.
Right, with providing those annual checks that will make sure that people are healthier. We're going to take a break here, but when we come back, we're going to talk about open enrollment, and we're going to talk about how you can connect with Vantage Health. Stay on point. We're back after this. Welcome back, everybody, to the OPT Network. Our guest this morning is Mick Essex. He is the Regional Marketing Coordinator for South Louisiana for Vantage Health. And this morning's conversation is really critically important for those people who are choosing Medicare, or you're already with a company, and maybe you're really just not satisfied with the benefits. Maybe you haven't understood it in a way. So what we're going to do on this journey is we're going to help you through the process so that hopefully you don't have any questions and you don't choose a company that you feel is telling you one thing but doing another. Before we went to break, we were talking about free versus free. Now, I know free is not the verbiage that the federal government wants to use, but when you're talking to seniors who are already on a fixed income, and you're talking about this being free, and then they show up and they're thinking it's free and they get a bill, or it may not be a big bill, but when you're talking to people like my mother, free, if you say free, that means I'm not going to get a bill. Let's just talk about the things that throw free off.
Right. Yeah, a good example of that would be the annual wellness visit.
Okay.
Every health insurer offers a wellness visit at no cost. So someone goes in and they've been told this whole time that my wellness visit doesn't cost anything. Well, whenever you go in, there's certain things that are done and not done that make it a wellness visit. So they check your blood pressure and they put the stethoscope on your back, breathe in. They go through all those steps. Well, if you mention something in that visit and they provide that service, for example, I have a tickle in my throat, and they take a sample, what have you, that's not a wellness visit anymore.
So that changes the whole wellness visit?
That change, well, and yes and no. So all of those things that they did do that are included in the wellness visit, there's no charge for that still. But whenever you go up to the counter after you leave the doctor's office and he gives you that little sheet of paper to take to the receptionist, there's a whole bunch of different things on there that he just did. She puts all those codes into the computer. If one of those codes come back as not a wellness visit, then a bill is automatically generated. And because things are so automated now, there's not a literal person checking those off. It goes into a system, it runs through the whole process, and if a code pops up that isn't on there, then there's going to be a charge for that, and it'll be your copay. It won't be just a random bill, but you will be charged a copay at that point. So as we do our customer surveys throughout the year, that started to come up more and more and more because the elderly may not be 100% sure of what something randomly
Because they
said.
heard free.
Right. So
But
no matter
then
what
I
happens,
had another problem. So I'm going to explain that problem to the doctor when I went in. But I didn't realize in saying I need you to check my knee or something like that, that was going to add and take away from free and add a bill.
Exactly. And so what we did is we came up with what we call a wellness coupon, and it actually has every single one of the codes on it that are no cost. So we explained to them whenever we're at the table, whenever you go for your visit, give your doctor this sheet of paper. Do all of this and nothing else.
Okay.
So that way they could get every single thing that was included in a wellness visit at no cost.
Right.
And they would not incur any cost after that.
And this created transparency.
It did. And I'll tell you another thing that came up that was really unexpected is that there were several codes on that list that the doctors didn't know was included at no cost.
Wow.
So we actually helped the doctor make more money on that visit because he had a full list of codes he could do and get paid on every one of those.
Right.
So the inadvertent advantage to that was we actually helped doctors make more money.
Right.
So guess what they're going to tell their friends and family and patients? You should look at these guys.
Right.
You know, because they really are interested in taking
And
care of you.
in that, it also not only did it help the doctors, but it helped the patient because they may not have gotten those services because the doctor didn't realize that was considered part of the wellness check.
Exactly, and there's been plenty of cases where there was an underlying condition that they didn't even know that they had, that we were able to catch early enough to combat it with preventative measures as opposed to a really costly surgery. So it was a win-win-win, honestly, all the way around.
Sure. So people who are saying, okay, Mick, this sounds really good, and I'm with another company. Open enrollment is coming up when?
October 15th is the first day of open enrollment. That's whenever you can actually make a change, to your health policy. Any change that you make doesn't take effect until January the 1st.
Okay.
So whatever you have at that moment, you're going to have October, November, December, and then you begin with us on January the 1st. So it begins on October 15th, and you have until December the 7th is the last day that enrollment closes.
So I want to talk about making changes because sometimes seniors get set in where they are. But maybe they're not necessarily happy with the services that they're being provided. How challenging is it, or how easy is it to make the switch to Vantage?
It's actually gotten a bit easier. The enrollment process takes less than 10 minutes. It's actually quite quick. But a couple of years ago, one of the things that the Obama administration put in place before he left office is they instituted another enrollment period in the first quarter of the new year. So let's say that you have Humana now.
Okay.
And October the 15th, you switch to Vantage. That starts January the 1st, and say by February the 5th, it's just not what you were looking for. It just wasn't the company that you thought it was going to be. You have between January 1st and March 31st to make a switch. You can make one change. You can either switch back to the company that you were with, you can go back to original Medicare, or you can choose a whole new company. So even if let's say you fall for, the smoke and mirrors and you sign up for a health plan and then January the 1st comes around and you don't like it, you still have the opportunity to change one more time in case you felt like you didn't make the right decision. So it's gotten easier, the enrollment process, and it's gotten better because there's a safeguard in case you think you made the wrong decision.
So for those people who are saying, yeah, I'd like to take a look at making the switch, so what do they need to do?
The easiest thing would be to call our 800 number. You can also go to vantagehealthplan.com and see a full list of how our Medicare operates. The initial phone call, it's a Q&A type scenario.
Question and answer.
Question and answer, right. And if the member service representative that you're talking to, because they're not licensed insurance agents, if they get to a point where they can't answer a question, then it rolls to my department.
Okay.
And if it's in South Louisiana, And Alexandria is actually my cutoff point. Alexandria South, then that call comes to me, and then I route that call to one of my guys that are on my team that can actually go to their home and talk to them in more detail.
So before we've got to let you go, I know this is important probably to a lot of people who have Medicare. You want to look at your prescription and your cost for prescriptions, because that's one of the main expenses that most people will have is their medicine cost.
That's correct. We have more claims for medication than anything else that there possibly is, and that's why we actually opened our own pharmacy in Monroe. We have a pharmacy on site, and through that, we're able to fill generic prescriptions through the mail at no cost at 90 days at a time. So that way, you don't have to leave your home. It's a one-time phone call. You'll get a form in the mail. You fill out what your medications are, send it back, and then you'll start getting in your mail within just a couple of days. Because
they started their own pharmacy.
We did.
It doesn't get any better than that.
It's really very interesting too, because it is an actual pharmacy, and because it's in one of our older buildings, it was built to look like an old soda fountain, pharmacy from the 1950s with the marble floors and the columns and the whole thing. So it's an actual pharmacy, but it was created so we would have our own capabilities to fill our medications, and in less than only 6 years, we're filling over 2,000 prescriptions a day for our membership. So it just made it easier, to build it on site so we could get the medication out quicker.
So I know a lot of people really, especially seniors, scurry away from digital and going online. So for that one-on-one conversation, what's the number that people can call to find out which questions they have, which benefits are going to best serve them?
It's the phone number is 888-823-1910.
All right, one more time.
888-823-1910.
There you go. Mick, we want to thank you so much for sitting down, and we're going to have many conversations between now and open enrollment and during that process so that we can answer people's questions and give them a sense of peace about choosing the right healthcare company. And we believe that Vantage is doing head and shoulders above their competition in just doing the work of being there and satisfying those questions. So thank you for the work that you all are doing, and thank you for taking the time.
Absolutely. Thank you, Carlette.
Indeed. Our guest this morning, Regional Marketing Coordinator for South Louisiana for Vantage Health, Mick Essex. Stay on point. We're back with more right after this.